But if this is a problem that it's actively affecting your life, you probably think about it anyways. You're thinking about it anyways. You're thinking about your knee. You're thinking about your hip anyways. Why not think about doing your workouts anyways? Hey everyone, this is Coach Raul.
I'm Coach Jay, and this is Joint Effort.
We're going to talk about something today that comes up when we talk to people that are working on fixing their hip and their knee osteoarthritis.
Correct.
Which is becoming more obsessed with working on your glutes. Because in the context of what we do is we're trying to treat the problem from a muscular imbalance standpoint, where people usually have dominant quads and not so strong or not so dominant glutes. So, Coach Jay, we've been talking a lot to people in the knee and the hip arthritis program lately about just trying to avoid working on muscles like their quads and their hamstrings if they go to the gym or they do any kind of physical activity.
Right.
And we're trying to steer them in the direction of working on their glutes, but working on them to the point where they're almost become obsessive about it.
Yes.
So with that being said, what would you tell a person who's coming to you and they tell you, hey, like I'm ready to join the program. I see that the physical therapist down the road is making my friend or whoever work on some knee extensions.
Right.
How would you approach introducing someone to what we do and introducing them to how much we want them to do?
That's a great one, man. All right. So first and foremost, the glutes are your butt muscles.
Yeah.
Not gluten, like gluten intolerant. So glutes are glute muscles, which are your butt muscles. So first things first is understanding the concept of the muscular imbalance, right? So as you age, certain muscles start to atrophy, they start to disappear, right? And 9 times out of 10, it's probably the glutes that go first, right? Especially after 2020.
Yeah.
We were all inside watching the 1,000 episodes of Netflix series.
Yeah.
And so a lot of people were sedentary.
Yeah.
They were seated. So a lot of people, after that passed, they got back into the gym. And the first thing they want to work on are the show muscles, the pretty muscles. And I would consider that to be your quads, your hamstrings. Those muscles tend to be the ones that people kind of look at.
Yeah.
We're trying to reverse that thinking, and we want people to focus on the glute muscles.
Yeah.
So why? The glutes are a much bigger muscle.
Yeah.
They help to absorb shock, right? So if you're playing any kind of sports, like we recently got into pickleball, I can definitely tell if your glutes are not strong, you're not going to have a good time.
Yep.
So I would definitely just tell people to work on the butt muscles.
Yep.
And the way we do that is...
So the first order of business with someone hasn't worked out in a while, like let's say the last decade or maybe 20 or 30 years, you're usually talking to adults that are older than 50, 60, 70, even some 80-year-olds. And, you've been sitting on your butt for a very long time. So it's likely that these muscles are just not very awake. That you cannot voluntarily activate them anymore. So what we work on doing is we have to repeatedly across the day, several times, make the glutes kind of wake up. And we do this with the 10-second holds. We were talking about this last time. What we didn't talk about much is how much dedication it takes to actually wake up all these muscle fibers. Recently, during one of our conversations that we had with our groups, there was a person that became a little overwhelmed by us telling her, hey, this is something that you should do on an hourly basis. You should be doing 10 reps or trying to aim for 100 reps a day. And it can sound like it's a lot, but when you put it into the context of how much time it really is, it's not that long. Right. However, you are walking, you are going downstairs, you're coming upstairs, you're sitting, you're standing up, you're driving, like you're doing all these activities in which you have opportunities to actually do these tensile or these isometric contractions. I say isometric in the context of You're just holding tightness. You're just tightening the butt muscles. So as long as you're doing that repeatedly, you're still working on the program. You're still doing the program correctly.
Right.
And or if you're not in the program, if you're someone who's on YouTube and has looked at Dr. David's really nice videos where he talks about how to get rid of knee pain, some of the exercises that he's showing you there, the more you do them, the more relief you will get because your glutes will become more awake. They'll just get a lot stronger.
So you talked about doing daily activities such as tackling stairs, walking in the grocery store, driving, right? Taking road trips. It's summertime, so a lot of people are traveling. So you're doing a lot of walking, and if you're not using the proper muscles, you're just going to be adding more stress and compression to the knee or the hip joint. And the best way to get past that and to get through these trips, your trip to the grocery store, maybe walking down to the basement to do your laundry, the best thing to do is get those glutes activated. And the reason we say become obsessed with it is so that way, I think of it this way. You do the boring stuff first, so that way you can get to the fun stuff like the hiking, the pickleball. What else are most of our clients into, man? A lot of swimmers.
A lot of swimmers, you know what? Surprisingly, a lot of people are into rowing.
Rowing?
Rowing's a good one,
So we give you guys something easy enough to do anywhere. It requires no equipment. You don't have to sit down on the floor. You don't have to worry about getting a special bench for this. You can simply do it. I like to challenge you guys while you guys are watching this to just simply try and squeeze your butt muscles and see how that feels for you. That's the thought process behind it. And it's so easy that you can do it continuously throughout the day and become obsessed with it.
You, while you were talking about this, you reminded me of a question that came up in the comment section on YouTube, actually. There was a person talking about how she could feel like one of her glute muscles was working, like the right one, but not the left one. I might be remembering these wrong, which one was which. So it got me thinking, there's a lot of people out there that are already hearing the message, they're already understanding the concept of what we're talking about here. And but they just probably haven't heard us say how often these things need to be done. So to that person that hopefully you're watching this video a couple of days from now, what you need to do is you need to start squeezing that other glute muscle a little bit more often so that it wakes up. It's a difficult task, I get it, but the more you do it, the more proficient you will become at it.
Correct.
Now, what Jay and I do here is we coach people on one-on-ones, and we coach them through group coaching. And one of the things that we always share with each other is strategies that we use because we have different personalities. Like he has people that also, he works with people that have different backgrounds. But what do you say to someone who gets overwhelmed by the amount of work that you're asking them to do? Like, hey, coach, like this sounds like a lot. You want me to work on my glutes every hour? And then on top of that, you want me to work on my feet? And you want me to like I need to walk for exercise. My doctor told me that that's what I need to be doing. Like, what gives, man? Like, what am I supposed to do with my time?
That's a good question, man. So I'm kind of I got coined with the term mindset guy. I don't know, man. I like to think of things as don't make it another stress or another chore. I think we have enough of that as adults. You have things that you have to do, and it's not that fun. And this can be one of those things, but I would like to reverse that thinking a little bit. I just tell them to gamify it, man. I'm a person that likes to watch, Game of Thrones and all that kind of stuff. So if you have a favorite character, each time that person pops up on screen, just squeeze your glute muscles. That's try to make it fun. But in the same time, you're doing the work that's needed to help combat your knee pain or your hip pain and just start to work on that with such an easy movement. So I would just say, try not to make it a chore. This isn't a chore. We're not here to harp at you guys and, do the thing. It's up to you. We're just trying to give you the keys to make it easier and make it enjoyable. So that's what I try to do with my clients. It's like, hey, man, while we're on this 30-minute coaching call, let's try to see how many glute squeezes we can get in. I just try to not trick them into it, but just get them to think about it a little bit different. What have you done in your coaching calls there, man?
Well, to be honest with you, that one of the things that I tell them is, one, you're here for a reason. You decided that you want to tackle your knee or your hip arthritis in some cases. You want to avoid medication. You don't want to go to the surgeon and actually said, yeah, you know what, replace my joint.
Yeah.
You don't want to get an injection. And actually, I would not want you to get an injection. I'm more convinced each and every day that that's not the long-term approach that I would like for people to take on. And I tell them, you know what, the alternative to spending some more time working on this problem that you could fix with no tools.
Yes.
You could virtually take this very, very far with no additional tools. Granted, eventually you will need to start working on some progressive overload. You will need to actually lift some weights and progress there, but you can take yourself really, really far with just what you have at home. And just by, and that's one thing that I tell them. The other thing that I say is, okay, there's an ad going on YouTube, Judy, she says, I'm a glute person now.
I'm a glute person now and not a quad person.
Yeah.
And I love that she says that, because it talks about how much she thinks about it.
Right.
And maybe you don't want to think about it too much right now, but if this is a problem that it's actively affecting your life, you probably think about it anyways. You're thinking about it anyways. You're thinking about your knee. You're thinking about your hip anyways. Why not think about doing your workouts anyways?
So essentially, you're already obsessed with something.
Exactly.
Why not make it something positive?
Yeah.
Dude, I remember you told me it was a few months ago, you had a client here that all they worked on, just because it was the only exercise that they could do comfortably, were glute squeezes, right?
Yeah.
Seated, standing, lying down. And the side effect of that was growing big glutes, right? So it doesn't take much to start. Eventually, like Coach said, you will need to build into progressive overload and using more sets, reps, and weight. But for now, I think a good starting point is just learning how to squeeze your butt muscles, your glutes, and just become proficient at that. And the side effect will be nice glutes.
Nice glutes, I mean, and who doesn't want nice glutes? I mean, I wouldn't mind that being a side effect of fixing my hip or my knee issue. But, and you know, this person, she was absolutely obsessed with her glutes. She had a spreadsheet that she would share with me all the time. And I did this many reps at 9 a.m., 10 a.m., 11 a.m. She had it laid out. And I remember every time that I would talk to her, I would just think to myself, man, this is really what it takes to fix a problem like this without relying on outside things. Because, you know, there's a lot of options out there. I get it. And this is not the traditional medical approach. In many cases, of course, there's a lot of good PTs out there and a lot of good doctors that will tell people you should be exercising. But what they don't tell you is these are the muscles that you need to bring up a little bit more and get stronger at. And there's no specifics.
Right.
And what we worked on, now that we've done a few thousand coaching calls, we've worked with a few hundreds of people by now. Yeah. We've seen it happen. We've seen it over and over and over again.
I'm thankful that we work with a doctor that does want people to do more in life.
Yeah.
And that's what I love about the free YouTube videos, the programs that are released. They're giving you keys not only to fix your hip or knee arthritis, but to get you back to enjoying spending time with your family. I have a son at home. He's just turned 6 months. And I can see where I need good hips and good knees to bend down and pick him up and, you know, carry him around. And I would imagine that a lot of people in our realm are grandparents. Yeah. And let me tell you, my grandfather taught me how to garden, taught me how to fish. And he was not a lazy person. All the way up until, you know, the day he passed, he was still exercising and getting it done. So that's a good thing about this program. We're not only teaching you how to use your glutes or to fix your knee or hip arthritis, we're giving you keys so that way you can truly enjoy your life.
Absolutely, yeah. And we understand our demographic. We know that maybe we're not going to have a lot of 20, 30, or 40-year-olds like watching this video right now. But if you're in your 20s, 30s, or 40s, man,
start now.
Yeah. Work on it. Like this is a problem that starts in your younger age. I mean, you do see a decrease in other muscles. I mean, when you look at data or like studies, there will be a decrease in other muscles, but the glute muscles, they get weaker too. And they're a cornerstone muscle, like Coach Jay said. They're responsible for a lot of functions in your hips. They're responsible for a lot of stresses that go through your joints. And if you get really weak in those muscles, then you're setting yourself up to have some problems. So start obsessing about it now. I mean, who doesn't? And again, who doesn't want to get nice, working, strong glutes?
Exactly. So, I had to work on my glutes, so I hope you guys are working on yours.
Coach Jay,
good talk, Coach.